And it's interesting too, because, as you think about healthcare and the more that you talk to, I think people who have spent time in the space, like they
Mhm.
realize the body is a machine, right? And yeah, it's
Mhm.
got emotions and kind of all the things that make us intelligent life and all this stuff. But at the end of the day, it is a machine. And a lot of that
Right.
diagnostic testing and lab testing is trying to, just like you diagnose what's wrong with your car, right? It's trying to
Mhm.
diagnose what's wrong with the body. But the processes, I'll use the word broken. You may not use that word, but maybe just talk a little bit about like what are the issues in the legacy model, and then we can get into kind of what the idea for Everlywell was and kind of what you've built.
Yeah, I mean, I think why healthcare continues to be both broken and yet have so many people try to fix it, um, to varying degrees, successfully or not successfully, is because there are hundreds of different interrelated and interwoven factors where you pull one lever and you make it better, you affect the next. And so if you look at this spaghetti web, whether it's primary care, whether it's specialty care, whether it's hospitals, surgeries, lab testing, prescriptions, these are all factors that play into an overall, what I call industrial complex that is broken in so many ways, and often because the incentives are so misaligned, not because any one party is saying, I want to not provide good healthcare, right? That is not the goal. I really believe that people's goal is to treat patients in the most effective way possible, but we don't get there because it's so broken. And so for my experience specifically, and I think what I see a lot of, especially in women's health, but even more broadly, is um, you go to a physician. That physician is either a specialist or a generalist. They are under immense amounts of pressure, billing, time and appointments, documentation, all of these things. They're doing the best they can with limited information and time. And then they have to order tests. And then they have to make decisions about what they're going to order based on how you relate to their particular specialty and otherwise, or refer you elsewhere. And what I really think a lot of the problem is today is a lot of your services are disconnected from your core physician. So whether that's an MRI or a lab or a surgery, you have all these different services that your insurance is going to get billed for. You as the patient don't know how they relate. You don't know what they're going to cost, even with insurance. And then you ultimately don't have someone coordinating centrally on what all this means for you, unless you are part of concierge medicine, right? Which is again typically reserved for kind of the wealthy and for people who can afford that. And so I think it is just a model that needs so much change, and yet there's not one way to change it that's going to fix it. And so you have all of these different pieces that make it very difficult to affect change, unless you are in this moment when I think there's been a lot of good change on the regulatory front with the pandemic. So we can talk about that later. But yeah, I think that's the holistic view that I have. I focus a lot on access and price transparency because those are two of the particular areas where I think I can help and where I think a lot of Americans put particular focus. But those are not the only two issues, right? It's so much broader than that. That's just where I think that I can play a role.
For sure.